Hello and welcome to today's CDCT live session. My name is Jason Rader and I'll be your host as we talk about today's topic, which is security in the healthcare field. With me today, we have two experts that are going to help me have a conversation in this area. With us today is Mark Walker, Senior Security Consultant, and Jeremy Nelson, Practice Director of our Network Professional Services area at CDCT. Welcome, gentlemen.
Thanks, Jason. Great to be back with you, sir.
Likewise. Glad you're here for the first time, Mark. Hopefully we don't scar you too much with this conversation.
Oh, thanks. Glad to be here.
So for the folks out there, what our intent for sessions like this is to kind of, this definitely isn't your comprehensive, everything you need to know about everything in security and healthcare, but we wanted to give kind of the different areas of expertise, mine being security and frameworks and those types of things. Mark having experience as a vCISO for a very large health organization, and Jeremy as our director from a networking professional services has a lot of experience helping clients in this area. So within that construct, we wanted to kind of bring the leadership view, the security view, the regulatory requirement view, and the aspects of networking, security, and infrastructure to kind of an interesting conversation. So that's our intent. We'll see how it goes. But guys, did I kind of sum that up fair enough for this session?
Perfect. You're the framework guy, and I think you set up the framework for this conversation perfectly.
And you answered that perfectly, regardless of whether it was accurate. So first of all, what I wanted to kind of start with is, Mark, your experience is significant in this area and in a very highly regulated state. Tell us a little bit about maybe the unique qualities of being a chief information security officer for in a healthcare environment.
Well, in a healthcare environment, being more highly regulated, similar to financial, there's a lot more compliance involved than just security, as well as the various different environments that you may have at a hospital in terms of education and patient care and the lab and radiology, and they all have different security profiles. And so it's a very dynamic environment that requires a lot of attention. The primary mission of a healthcare organization is, in fact, patient care. So sometimes you have to fight for the attention that it really, really needs. Having a very good chief medical information officer who you partner with oftentimes helps that, because that person can help you make the argument that part of treating the patients is protecting their information.
Oh, fantastic. And I think, you obviously from that particular statement, where there's a lot of stuff we can talk about. I think you mentioned some stuff that I know that Jeremy's got an opinion on, the aspects of, he said security, it's more than just security, right? And I think I kind of lump all of those things that I think about into the security bucket, but there's so many other aspects of it. Tell us some of the stuff that you kind of run into when you're in an environment like this, Jer.
Yeah, I think it's perfect the way that Mark set that up, is that at the end of the day, the overall objective of the team within the healthcare organizations is all about the well-being and taking care of the patient, treating those physical, just the physical needs that they're currently being challenged with. And the way that they do that is just like all of us, right? Or every industry that we engage with, is that the way that they do that is evolving, and it's including more and more technology. It's including more and more connectivity, more and more data analysis. And so there's more data than ever that's currently flowing from these individual systems that are out there trying to provide that best of breed care for these patients that are in need. And so to do that, there's this accelerated number of devices that are being brought on to these infrastructures that are enabling this type of care to take place. And one of the things that we typically run into, Mark also did, highlighted really, really well, that we have these different personas, we have these different groups out there, and that they're all out there trying to do the best that they can for their patients and those that they're caring for. And so they're bringing on and they're onboarding these different devices. Well, each one of those, depending on the use case or what they're trying to do, has a different security persona that then gets bundled into the overall organizational persona. So yeah, I think one of the big things that we run into is just, number one, how do we wrap our arms around what's out there? What are the use cases that they're being used for? And what are some of the controls? Like, how do we protect the data? Because, we talked about, and Mark said this really, really well, they're there to care for the physical needs of the patient at that moment, but their data is a much longer term more nebulous need that they have. And if there is any compromise to that, that also doesn't necessarily go towards the long-term care for that individual. So making sure that their data is protected and that their livelihood beyond just the care that they're receiving when working with that hospital professional is really, really important.
And I think you got me all. Hospitals are businesses as well, typically, and well, regardless of whether it's a hospital or whatever kind of healthcare we're talking about here, there's a budget involved, and we've got to meet those budgetary requirements to do what we do. So some of that, with the awesome onslaught of the different types of technology that we can embrace and platforms that we can leverage, that kind of exacerbates it as well, because there's a push from a business perspective to bigger, better, faster, more, or do more with less, talking headcount typically in those cases. And so that incorporates, there's a lot of brilliant stuff from a medical devices perspective that we expected to kind of be there. And then there's some other stuff that ends up being there and there's lots of different groups to Mark's point that are all they've got agendas and initiatives. And one of the things that I see typically when I go into a large organization, regardless of whether it's healthcare, is that there's initiatives on this side of the table, initiatives over here, and they never really talked about them together, any efficiencies that they could leverage. They were looking for those efficiencies in tech or something externally, and that creates a bigger problem as well.
Yeah. Go ahead, Mark.
That's true. One of the things that we've had to do in a couple of hospitals that I've worked at is integrate security with architecture, because a lot of people have a good handle on their enterprise architecture. If they're lucky, a lot of people don't. But if you're going to do the effort, do them in parallel or piggyback security onto an already functioning architecture group, because security is part of your architecture. And when we look at confidentiality, integrity, and availability, security people address them in that order, but the patient care providers address them in the opposite order.
Yep.
It's all about availability and then integrity of the information, and then the confidentiality is like an afterthought. And what we do so is how the system is configured. And so we live in that confidentiality and integrity box with the architecture group. And so there's an opportunity there for us to climb on board that. And I think that's where Jeremy and I overlap, because if you don't have proper network segmentation, if you don't have proper asset classification, if you don't have patching laid out in the right way, then the infrastructure won't support the best system.
Oh, well said. Jeremy, you had an interesting point that you had brought up earlier about trying to find devices on the network.
Yeah, so it was funny. One of the, so we work with a lot of different healthcare organizations, right? And it's interesting to see, you think about patient care, you think about the types of devices, you think about the way that data is used, and there's one underlying theme that always seems to be the same, is just, again, we're talking about this accelerated connection of medical devices to the infrastructure, and it's just, what is actually out there, right? And this comes back to Mark, is that, you got these different groups that are going out there, they've got their individual initiatives, they're trying to accomplish those, and it requires a technology. And the architecture isn't necessarily considered. It's all about, I got this is the use case that I'm trying to solve for my patients, and these are the minimum requirements to get it connected and to function, right? But then it's a set it and forget it. So one of the organizations that we worked with was really all about just like that, just like Mark was saying, is how to create a logical network segmentation. How do we identify those devices and define policy to be able to protect these assets and that data that they transmit and hold? And the first one was just figuring out what was out there. So going through a different set of data gathering exercises. So everything from traditional scans of looking up MAC addresses, scanning for ports on a device and trying to fingerprint them, but really taking it to the next level and looking at data patterns and data traffic. And one of the best ones that I love to call out is that one of the organizations we worked with was going through a specific initiative around identifying Windows XP devices, right? We all know exactly where XP is in its security life cycle, or lack thereof, I should say. And so one of the things we found was a whole series of what looked to be medical appliances running Windows XP. And as we dialed it in, we looked, and they were basically running the exact same version of Windows. They had the exact same Mac OID, so they looked like they were the same manufacturer. And so with traditional methods, the logic said these are the same device, and we would have applied the exact same security policy to them. Well, through the enhanced overall analysis that we did, we were able to say, oh, never mind. This one is a medical imaging device associated with mammograms, and this one over here is a prescription locker. Two totally different use cases with two totally different sets of security profiles associated with them. So it's interesting stuff like that. It's really a challenge for, we're talking about healthcare today, but I don't think it's far to say that every organization struggles with that.
Yeah. And I think, the sad part about that is you used techniques, you found the OIDs and the folks, the operating systems you thought were the same. To actually resolve that probably required a lot of additional effort to go. Somebody had to go there or trace the switch ports back or whatever happened to be going down. And that's something that, we don't have folks sitting on the bench waiting to come in and go out and corral all of the medical devices and see what's out there.
They're trying to keep systems up and keep people healthy.
Yeah.
That's their job.
Availability, right? That was the big thing.
Number one,
and,
Mark said.
And looking at that endpoint device plus one is a lot of extra work, but it's the important work to really understand what those devices do for a job. And some of them can be replaced, but some of them are older devices that are not slated to be replaced, and they're quite expensive, like electron microscopes. And it will not support a newer operating system because the vendor of that particular device has never upgraded it. And so there's a lot of challenges in setting your priorities of, are you going to replace that device? Do you have the capability to isolate that device? A lot of extra things to worry about.
It comes back to Jason's budgeting conversation, right? Like at the end of the day, there's a bucket of money, and that bucket of money has to get as much done as it can. And sometimes, just like you said, Mark, organizations have to look at, okay, I've got this device. Yes, it's end of support. Yes, it's got some vulnerabilities, but I don't necessarily have the money to do a full, just all-out replacement.
New electron microscope.
Yeah, my goodness, like that's that's a significant investment. Are there security controls that we can put into place to help reduce the overall risk of this particular vulnerability that allows us to sweat that asset a little bit longer and use the budget to continue to enhance, whether that's the security controls or the security posture of the environment, or whether that's again bringing on other tools and assets to help further patient care.
And now that we kind of talked about it, let's, all of these devices, we talked about the highly regulated situation that healthcare providers are under. All of these new devices just add an additional layer of complexity related to compliance. And I remember it was kind of a eye-opening experience really early in my career when I looked at, I'm thinking, oh, there's a specific framework that everybody kind of rallies around. Maybe HHS defines it, and it's prescriptive to a large degree. And then when I got in and saw it was a map that took up the entire wall of somebody's office of all of the things that, from a regulatory and governance perspective, that they had to deal with, and that was mystifying. Just even understanding the complexities took a few hours for me and that person. But that's a gigantic amount of stuff to weed through now that we've added all of these additional endpoint devices. What do you do in that situation, Mark? And I guess what my question is I'm kind of driving towards high trust. Is there any help in something like a standardized framework that comes out like something like that?
Well, you have to pick a framework. And the reason that the healthcare organizations I've worked with have chosen high trust is it was originally done for healthcare. Now they've broadened it for all industry, and healthcare is just one of the streams through the control framework. But it also takes into account NIST and ISO and takes the most prescriptive components of each. And that's really important, because if you don't have a framework, you don't know what I'm doing. I started with one organization that hadn't picked a framework. And when we did their first assessment, speaking of floor to ceiling, the list of findings was from floor to ceiling printed out. And it was like 400 and some on findings. And a lot of the findings were basically, they were attempting to do the right thing, but they hadn't documented anything. They didn't have all their policies in place. They didn't have documented procedures. They did have procedures, and those procedures were implemented, but they weren't necessarily implemented consistently. And so just introducing the rigor necessary to fully meet the intent of the control framework is a very big job. And HITRUST also covers PCI, and I like one of the things that HITRUST does in terms of, say, assess once, report many.
Yeah.
And so through your HITRUST assessment, with the mapping that HITRUST has, you're able to create from the information that you have collected most of a PCI assessment.
Yep.
And virtually all of a NIST assessment, because HITRUST now will give you a NIST scorecard and link your answers to the assessment questionnaire to NIST itself. And you can actually report out on that. And so those make it a lot easier. It's the hardest part to get management to understand how frameworks work. And so if you can simplify it, and I think HITRUST does a good job of that, because the way you assess is way more complicated than the way you report. And that's where the benefit is, being able to report properly and give the attention to the board and to executive management so that funding goes to the right places in the right order. Because you can't do these things necessarily out of order, because if you need security and you can't segment your network, then you need to work on your network first.
For sure. No, I love a couple of aspects of that. That whole assess once, report many is a big deal. The CIOs that I talk to really, and again, the CFOs that from a budget perspective, they're dedicating like head count to all of the different compliancy and requests that they've got, and not just in healthcare. So like literally our organization actually just aligned with HITRUST as well for that same reason, because if we can kind of streamline the process, we've got SOC 2, we've got PCI, we've got all those same things, but again, aligning to a framework that lets us report many times with the same efforts, and then also something that's recognized with the rigors of where it came from, healthcare, and now that it's being supported by many, many more industries, and I really like what's going on there. That's a big deal. So I think that that's one of those things where, and you also talked about the documentation aspect, which kind of stabbed me. I can remember lots of audits in my past where it's like, the documentation is my least excited part about an environment. I'd much rather talk about cooler things than documentation, but it's so, that process being defined and it being adhered to and it being auditable is such a huge point, because how are you able to prove it if you're not doing it? I think there's a lot of people with good intentions, like we've said, but how do you prove that to somebody externally to your organization? And you have to get those, dot the I's and cross the T's.
Yep. Yeah, we didn't like getting findings like that started with, although they have a policy. So you really kind of have to have that policy, procedure, and evidence of execution of the procedure to at least get yourself to a rating of 3, which is where most organizations start to feel safe. And then you move into your measuring and optimizing aspects of that. And so the maturity model really helps management understand that too, through the 5 layers.
I love the alignment with the maturity model as well, because I always preach that. It also helps people understand that you can't get to this level of maturity. You can't optimize until you've defined. Those are steps that you have to go through. You violate the laws of physics. You can't jump this without doing this. And I think that's that's also something that resonates with board members. Hey, here's where we are. Here's where we're going. So it's something that can be reported and leveraged on many levels. So good stuff.
Yeah. I think there's the opposite end of that too, right? So Mark did it sounds like you worked for an awesome organization that had the policy well documented and it just kind of maybe fell short on execution. I think we see more often than not the exact opposite of that, where we got a lot of folks who are trying, like you said, Jason, trying to do the right thing, trying to define policy, but it's not formalized, it's not standardized. And so you end up with this kind of snowflake effect of policies and adherence scattered across the organization. And then when you come back and say like, well, what is your actual standard? Like, what are you trying to accomplish? And you're like, well, security. And they just come back, well, we're trying to provide security. Well, what is that security? So I think that's a big one. And we've talked about that in a number of different of our forums, right, Jason? Is just the plan. If you don't have a plan, you can't be surprised if you don't end up where you wanted to be. So yeah, I think that's a critical piece.
You touched on it too in your speaking here, is you said standard. All of the control frameworks talk about policies and procedures, but standards are one of your most positive documents that you can create. And the assessors in virtually all the cases I've looked at, especially OCR, which addresses the HIPAA, they will look at a standard just as though it was a policy. And so because you have different levels of attention, you don't want to mix them all together. Yep. Where they get in trouble is where they have a policy, a standard, and a procedure all in a single document, because that doesn't respect who approves it. Yeah. So you really have to have those additional layers that aren't specifically required, but the standards are your strongest tool, I think.
Agreed. So that actually, I'm going to shift gears a little bit because I wanted to talk about, as of last week, this weekend and early this week, actually, there's been a lot of healthcare and ransomware in the news. And I wanted to talk about, so I did my, I'm a security nerd, and malware analysis and those kinds of things are exciting to me. So I did some research into this, and, it's the same, Ryuk is the name of the malware that they're using right now, and it's a derivative of other malwares. It's typically the same kind of mojo that everybody uses. There's a group that creates the software package, if you will, and they lease it to other folks for a campaign. And then what these guys are looking for is these big game hunting is what they call it. They're looking for the latest iteration of this thing has been aligned for enterprise. So that was the thing. So they made it for enterprise, they lease it out to an organization and to whoever pays. And then those guys run the campaign. The whole ecosystem is terrible. I'm not saying one person's better than the other. I'm just saying that that's kind of the disconnect that exists. But on this particular campaign, there's two things that I wanted to bring up. One, that we always talk about people shouldn't pay the ransom and those kinds of things. But these days, to get things back online, people are paying the ransom. This campaign, and I know how this works, they just happen to, the good guys happen to be able to intercept some of this stuff. That doesn't happen with every campaign. But on this one, they saw for a fact that the Bitcoin locker actually incremented $4 million. These guys made $4 million since August, just on this one particular campaign that we had access to that one locker, that's a lot of money for no particular effort on their part other than leasing some software and infecting some systems. But the real thing that I want to get to, sorry for me being a nerd, total nerd alert there, was a lot of the things that could have dealt with this are blocking and tackling, kind of back to that old stuff that you were talking about, Jeremy. It's like, hey, somebody had to be on the network to make a request to a domain controller using the zero login vulnerability that Microsoft had issued a patch for. So they had to get on the network somehow. So regardless of how that happened. They got on zero login. So that is patching, back to Mark, you mentioned that a couple times. And then we also talked about availability big time. And the killer here is to patch this thing, you've got to reboot the servers. So it's kind of like this, it's nothing super awesome. That this isn't like quantum cryptography at work or any of that stuff. This is just somebody exploiting the fact that they could get somebody to click something or get something on their environment, that there was a server that wasn't patched. They disable logging on the local machines, and they disable system restore, so you can't use that to actually get back anything that they've encrypted. But it's just some standard stuff. But the limitations, especially in healthcare, so these guys targeted healthcare for a couple of reasons, because they couldn't reboot their systems. They knew these environments weren't patched. And so it's that perfect storm. And it kind of, again, I know you guys are going to say yes, but Jeremy, do you see environments where this is probably the norm, right? Is they can't reboot the systems?
Yep.
Go ahead.
Oh, absolutely. You hit the nail right on the head, Jason. They're taking advantage of the fact that it's pretty well known. Healthcare, by far, just because of the life-saving nature of the systems that they leverage. You can't just reboot those in the middle of the day. You can't just push down a patch and be like, hey, you get 4 hours to postpone this. Otherwise, I'm rebooting the device, no matter what you say, because this patch is critical. you just can't do that. That's not realistic. And some of these systems just are in continuous operation and continuously connected to life-giving, life-saving needs. And so, yeah, it's you hit the nail on the head. And I think the interesting aspect to this is that it's really kind of like it's a twofold journey, right? And we as an organization go through the same thing. The education component, because just like you said, this all started with they were able to convince somebody to click something, right? And that's really how a lot of these propagate, is starting with assumptions or the human vulnerability in any IT system, right? And then it's our job on the IT side is how do we build controls to try and limit that risk as much as possible, right? East-west traffic on a network segment is by far one of the most exploited gaps that we have, right? You get into one system, and as long as there's something else that's on the same layer 2 domain, it's open season, right? So yeah, I think there's a combination of both. Is the security controls that we can bring into place, the frameworks that we can build as an IT organization, but making sure that we continue to drive that down into individual end user education as well.
Oh, thanks.
The end user education is important, but also communication, because there was one organization I was with that found out from a user that they had a breach because the user called up the help desk and says, I'm getting all of these bounced emails and I don't remember sending them. You've got tools to discover that. You don't need to count on your users to do it, but at least that person reported it. The other part is how creative in a 24-hour a day organization. You have to get creative on how you do your patching, and you have to understand the cost of not patching. I think some of these high visibility things are helping with the understanding of the importance of this. Some of the strategies we've taken is standard routine preventative maintenance includes patching. So when it's offline, it gets taken over, the patching gets done, and it gets put back online. So you have to create categories, as we're back to asset management. You have to create the categories based on the risk profiles and the operational profiles of the machines. Your business machines are pretty easy. It's also important because of the remote nature of things these days that additional entry points have started to crop up. And so your access management is your key point to really focus on to avoid these things.
No, that's a great point. And we were talking about patch management. If a patch even exists. I mean, we talked about other systems that if they're running XP, I don't recall the latest patch that came out for that kind of environment. So, I mean, that's the plight. I think that, and I hate to spin myself up on stuff like this because I get really excited. I'm like, man, there's so much work that we've got to do. But it's one of those things where we're doing it. We're making these appropriate approaches, and I think there's some blocking and tackling that has to get done. I love what you just said, Mark, about the risk perspective. I think regardless, we've got to understand the risk associated with these things. So it's our job as professionals to be able to communicate that to the business, the board, the directors, the community that exists that we're serving. And we've got to figure out the appropriate administrative, technical, and physical controls that have to be put into place so that we can secure this stuff. And and I think kind of the theme that we get to with a lot of our sessions is it takes more. It can't just be IT or InfoSec or these guys kind of driving this in a draconian fashion. This is a whole influence without authority. Everybody's got to work together kind of thing. So that being kind of our statement, what kind of pep talk do you have for those folks out there in your respective areas, Jeremy and Mark? What kind of pep talk would you give to folks that are tackling this? Please go ahead, Mark.
Well, the key here is that the majority of these attacks are capitalizing on known vulnerabilities in a more sophisticated manner. And it's the management of those known vulnerabilities which translates to risk, which really helps set your priorities. And we've had situations that we've seen where a single vulnerability spans across the entire organization, and patching that one, not doing all the patches, but looking at the high risk individual vulnerabilities and working on removing those or isolating those is the place to start. If you try to solve it all along, all at the same time, then it's insurmountable. But if you pick them off as in their risk order, it simplifies it a lot. Jeremy, you've probably got some stories of that as well.
A few. But I think I love what Mark said. I think the kind of like the pep talk that I would give, and one thing that and Mark, I know you'll relate to this, is that everyone that I've worked with in the healthcare industry are probably some of the most caring individuals that I've ever worked with, right? At the end of the day, they realize that their job is all about caring for people. And they tend to be very, very patient focused, even in the IT world, right? Even as you talk to the different IT groups within these organizations, they are laser focused on what they do saves lives. And so kind of taken from what you said, Jason, what would the pep talk be? Is that the overall security profile of the healthcare systems that the team is supporting are just as essential to patient care and life-saving as anything else. And making sure that those systems are available and secured in a way that allows them to continue to function and provide those essential care needs, you can't drop that, right? So getting them onto the network is one instance, but really leverage that general care and concern that the whole healthcare industry has as a way to rally the groups together, to recognize that we're all in this together. And that's not even just their own individual organization. That's working with your partners, right? So that's working with the manufacturers of the different healthcare devices and making sure that you're all collaborating together to really bring a secure environment that helps to provide that day-to-day essential care.
Well said. You got my vote. So thanks, gentlemen. This has been awesome. I love the whole, everybody's got to collaborate, that whole influence without authority type thing, understanding the mission that we're working for. I love what you said, Mark. I kind of sum it up by, eat this elephant one bite at a time. Let's figure out how to do this. There's a daunting amount of work in front of you, but slow and steady, targeting those things that expose us to the most risk and work your way down from there. And where, it's not always going to be a technical control. It could be a physical control, could be administrative, could be, here's how we have to handle this. There's a procedure that's in place that has to happen, and all of those things. But I think what I love to say is, within the environment, and to your point, Jeremy, it's not that the team is the 12 people that are the security team or the folks that are on the network team. It's the entire organization. And that's one of the things I think healthcare has done in general, is understanding from HIPAA and other initiatives that are out there, is that everybody has some role to play from a security perspective. And I think that's, to your point, Jeremy, that community cares about what they're doing and they care. And I think it's a great target for them to expose through high trust out to the rest of the community at large from a security perspective. So that's my effort to kind of wrap everything up there. Gentlemen, thank you so much. It's been a good time. Mark, appreciate your insight. Jeremy, thank you so much. If you'd like to know more about what we do here at Insight CDCT, please visit us at insightcdct.com. Thanks so much and have a great day. Thanks, gentlemen.
Take care. Thanks, Jason.
Thanks.
Thanks, Mark.